hard-pressed to know somebody who hasn't been touched by breast cancer. It's Breast Cancer Awareness Month. We're raising awareness now, and we're joined now by Dr. Patel, GBMC radiation oncologist. We are talking about radiation treatment. What is it, and why do some people have to get it and others not?
All right, so in most basic terms, radiation treatment's like X-ray therapy. Same type of energy that you would be getting in a regular X-ray or a CAT scan for diagnostic purposes. The difference being that the X-rays that we generate with our machines are stronger and more penetrating because we're not trying to take a picture with our X-rays. Instead, we're trying to kill off or get rid of any microscopic cancer cells that could still be left behind in that breast that was operated on. So that's basically what radiation is. And then to your question about why is it recommended for some and not for others, it's a great question, and so much of oncology care and breast cancer care is very personalized. So there are a lot of factors that we would evaluate. What stage the patient has, their receptor status or particulars of their type of cancer, and what type of surgery they've had. The recommendation for radiation would come if we feel that there is a significant enough risk of the cancer coming back in either the breast or the regional nodal areas where it would make sense to add on another treatment or therapy to help reduce that risk.
Side effects?
Side effects, there can be some amount of tiredness through going through the radiation. Most side effects of radiation are cumulative, meaning they add as you go. Skin irritation can happen in some capacity, although with modern day techniques, it's really minimal in most patients. That's something that a lot of people are nervous about or scared about. They hear stories from either family members, relatives, friends who've had radiation, 15 years ago and are kind of thinking about those experiences, and they're quite different now. But there is some level of skin irritation that occurs. Some women can experience swelling of the breast as they go through radiation and the inflammation that the treatment in itself causes. And then when we are treating lymph node areas, there can be sometimes an impact on swallowing temporarily.
Okay. All right, Dr. Patel, thank you so much for joining us, giving us that great information. The number to call, because our experts are still standing by, 410-671-0702, taking your calls with GBMC, educating you during this Breast Cancer Awareness Month. Jamie, send it back to you.
All right. Well,